Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And as you can see, I just took my mask off. But I'm going to ask you, be kind, be respectful to your fellow citizens and your family. Wear your masks, wash your hands, and try to be socially distant. And by the way, masks are not a political issue. It is a health issue. Please, wear your mask. Oh, we have a good show today. We, a lot of people don't realize that the COVID virus has been a bit more insidious than just the illness itself. It has taken a lot of people's minds, and it says, well, I could wait on my health care. Oh, my little pain in my chest, I'll wait until things clear up. Or I'm supposed to have gotten my various tests, whether it has to do with my heart or my GI tract or my arthritis or whatever. But so today we're going to talk about your health cannot wait. It's my extreme pleasure to introduce to you Mr. Jeff Welch. Jeff and I, and Mr. Welch and I have known each other forever, and he's the CEO of Florida Medical Center and of Tenet Health. It's a Miami-Dade group, which includes a whole group of hospitals, and he'll explain it to you. And we have someone who I'm proud to say is a graduate of our institution, the Assistant Chief for the Lauderhill Fire Rescue Department, and Dr. Frank Vittimberga, who is the physician advisor at Florida Medical Center. Welcome, gentlemen. Welcome.
Thank you. Thank you.
Well, Jeff, it's really a daunting task to know that we have people who are putting off their own health care because of the fear of being involved in an institution that might be caring for the COVID-19 cases. What do you have to say?
Dr. Lippman, and thank you for inviting me today. It's really an honor to be here with the other guests who are just incredible individuals. And, the teams at the hospital work so hard to protect our communities and our patients. But we're realizing that a lot of the patients are holding off on getting care. And this was in part by the governor's order back in March, which stopped all elective cases, but that was lifted by mid-June. And we saw an influx of patients that could be a little bit worse off than they were by delaying their care. And so we did, I've done a couple videos to go out to the community, to go out to our teams and talk about how delaying care could be harmful, and that people should not be afraid to come into our hospitals, to go into a doctor's office. They should not be scared. We are prepared with the proper PPE, the proper personal protective equipment. The doctor's offices are. Our community fire rescues protect the community incredibly well with managing them. And there's direct communication with all our teams to make sure that they're protected. So we think it's more of they're afraid that they won't be protected, but I want to assure your audience and the communities that that we are prepared, and they should not be scared and should not delay their care.
It amazes me to see how many people have put off really some vital health care needs, but that's why we're holding this program. Assistant Chief, it's a little difficult for me just to say Assistant Chief, because I'm always used to saying Chief. But we'll get you there. Jeff Levy, talk to us about Lauderhill Fire Rescue and your responsibilities in conjunction with Florida Medical Center.
Yes. Again, let me first begin by saying, Dr. Lippman, it's an honor. Thank you for having me on the show. Yes, I am a Shark alumni, and I'm proud to be a Shark alumni. Um, like you said, I'm the Assistant Fire Chief of Lauderhill Fire Department. My responsibility here is the run operations of the fire department, and what that entails is keeping my personnel safe and making sure that fire rescue is still responding to the calls for service to the visitors and residents of the city of Lauderhill. It's become challenging during COVID, just like everything else, to keep my personnel safe and to ensure the safety of the people calling 911. Florida Medical Center is our primary hospital that we transport to. I would say 85 to 90% of our transports are to Florida Medical Center. And precautions we've taken early on to ensure the safety of my personnel, as well as in turn ensuring the safety of the patients we're transporting we've been able to early on provide the proper PPE to our personnel for personal protective equipment. All of our personnel have to go through twice daily health screenings when they're on shift, keeping in mind that most fire rescue agencies work 24 hours on and 48 hours off. So during that 24 hours that my firefighters are here, they get a health screening at 8 o'clock in the morning when they come to shift, which involves a short questionnaire of any symptoms and includes taking their temperature. And then they also get that same health screening at 8 p.m. in the middle of their shift. So we're tracking to ensure that none of our personnel are coming to work with any symptoms. And that obviously is to keep the rest of the personnel at the fire station safe, as well as keeping the people that are calling 911 safe. If you're calling 911 for an emergency that's not COVID related, we want to ensure that we're not the avenue of transmitting that disease to you. So we've also early on, we are disinfecting our fire stations twice daily with an electrostatic sprayer. So all of the public services of the fire stations get disinfected at 8 o'clock in the morning and 8 p.m. in the evening. That also transfers to our ambulances. We've also put a mobile supervisor on the road, and their specific purpose is to respond to the hospital when those ambulances are treating or transporting a patient with COVID symptoms. And the purpose of that is to, one, ensure that our personnel are wearing the appropriate PPE level for that patient that they're transporting, and two, while the crew is inside the hospital transferring the patient to the emergency department, that truck is getting disinfected with an electrostatic sprayer before another patient or the equipment goes back in that truck. So these are some of the precautions we're taking to ensure that we're not transmitting the disease between patients and in between personnel. All of our personnel have to wear facial coverings while at the fire station for 24 hours, except during the obvious times, which is sleeping and eating meals. But we are social distancing during that time. Well, you're asking how it relates to patients in the field and the concern of patients waiting on calling 911 or patients going to the hospital. What we've noticed in a year comparison of our system alone, City of Lauderhill system alone, we've noticed that we've had a 25% increase of patients dying at home since this time last year. And we've also seen a 6.5% increase from this time last year of patients calling 911, but refusing to go to the hospital. This probably is attributed to the scare of COVID, like Jeff was talking about early on. Patients are afraid to go to the hospital. And part of our job as paramedics and EMTs is to educate those persons that they are going to be safe going to the hospital. It's our responsibility as paramedics that are responding to these patients in the field to try and educate them. But again, the key word was try. I can only try as much as the patient's going to listen to us. There have been times that we get on the radio with the ER physician and have that ER physician talk directly to that patient and tell that patient that it's in their best interest to go to the emergency room and that it is safe to go to the emergency room. But I've personally been on calls where people have said that they're going to take themselves to an urgent care center rather than going to the emergency room for something serious. The longer you wait in an emergency situation, we always say time is muscle, time is brain, time is heart muscle. The longer you wait of a person experiencing stroke symptoms, the worse off you're going to be. The longer you wait for a person experiencing cardiac symptoms, the worse off you're going to be. So, between the precautions that the hospitals are taking in the emergency departments, the precautions that the fire rescue agencies are taking, patients are safe to go to the hospital.
People need to see their doctors, and if they don't get to see their doctors, they then formulate situations which become worse and worse and worse and worse, and end up having to be in a situation where they have to call 911, and then they are refusing. As you say, the statistics show that they're refusing hospitalization, or they avoid calling you and going to an urgent care center, which is not, and with all due respect to the urgent care centers, I think they're wonderful, but that is not the place for an emergent medical situation. Dr. Vittimberga, sir, tell us what a physician advisor does at Florida Medical Center.
I do a little bit of everything, actually. I help make sure patients are in the right status. I help coordinate physician issues with the hospital. A mixed bag of activities. But as you were saying, we've really seen a decrease in people following up with their physicians. When we talk about it, I just got a call from my pharmacy the other day, and the pharmacy was calling to check on me because I hadn't refilled my prescription, and they wanted to make sure, because they said people are not filling their prescriptions and they're not going to their doctors at their prescribed time. This whole COVID got us out of our regular routines of going to the doctor, going to the hospital, and really, we've got to continue to encourage people to go, because these chronic illnesses, as you mentioned, the diabetes, the hypertension, these diseases, if they don't get treated over, it's fine if it's a couple weeks, kind of when we thought this might just pass by, but unfortunately, COVID is not going away, and even though it's much better, it's not zero. And, we still have to take the precautions, as you said, but we also have to get back into doing the things that, really are our regular routine, and making sure we take care of the maintenance on ourselves, so that we don't end up having to get transported by Lauderhill to the hospital. But, really the goal is to treat those chronic illnesses, but also if you do have issues that are acute, to make sure you call 911. The CDC did a study in the 10 weeks following the declaration of a national emergency in March. There was significant decreases in people going to the emergency rooms across the country for heart attacks, strokes, and for high blood sugar associated with diabetes. And so, those people, as Assistant Chief Levy said, there's a lot of people that are either not coming to the hospital or having bad outcomes by staying at home. And so, in that sense, we really have to encourage people to call 911 and understand that every precaution is being taken. And in a lot of ways, you're safer in the hospital or in transport than you are just going to do your regular activities, going to the store and those sorts of things. So it really, with the extra precautions and the knowledge and the commitment of our physicians and staff here, really it's important that people understand that it's safe.
Well, Jeff Welch, the CEO of Florida Medical Center, I know, knowing you personally, but knowing the Tenet system, in fact, really, I salute most of the hospital venues that we have in the state of Florida for digging in on a crisis which was unknown to all of us. No one knew how to fight this fire, with all due respect, Jeff Levy. But here we are. What do you do? I would assume, and either you, Dr. Vittimberga, or Jeff Welch can tell us, we've learned a lot over these last 6 months on how to deal with the COVID individual, the infected person, when they enter into the hospital realm. Is that correct?
Yeah, that is absolutely correct in that, we've learned a lot about treating these patients. In general, when we first started having these patients across the country, the patients were getting intubated on a much more frequent basis, having a tube put down their throats for breathing. We learned that was probably not the best way to treat these patients, that treating them with high flow oxygen without intubation works better. We've also got more tools in our arsenal to fight the COVID. Now we're using steroids routinely, and we've had good results with dexamethasone across the board. Remdesivir is a drug that's been approved. It was initially developed as an Ebola drug, but it has antiviral activity and has been shown to be effective. Those are really kind of the bigger things that we're doing, as well as convalescent plasma, where we get antibodies in the plasma of patients that have been infected and are able to transfuse that into patients that actually has a positive effect as well.
I'm sure that you feel very strong and very safe in the knowledge and the direction of people like Dr. Vittimberga and your people that are associated, the physicians and nurses, with your institution.
Yeah, absolutely, Dr. Lippman. Actually, what COVID has done, kind of by chance, is something pretty remarkable in terms of what I would call the growth of active communication in our communities. And what I mean by that is we have come together as a group. We have daily communications with our fire rescue teams, which have done such a great job. They are heroes as well. We have 3 days a week. We have calls with. I'm on a call with all the major CEOs of all the major health systems, and it's brought us together. Along on that call is Secretary Mayhew from ACA, who's just been incredibly supportive. We've had the mayor of Miami-Dade, Mayor Jimenez, on, and we talk about what's going on, and it's no longer is there competition. It's all about how we can work together to best serve our communities. We also have calls with the Broward Mayor, Mayor Holness. He gets all the mayors together and a couple of the leaders in healthcare to talk about what's going on, and that helps them manage their communities and their cities much better. We have weekly state calls. So I have found that you're not alone in this, that we have come together as a community to work together, whether we're competitors or not, and do what's in the best interest of our patients. So I want to be so clear to your audience and our patients that we serve every day that don't be afraid. We have so much strength in making sure the quality and safety of our patients are in place, that they should not be afraid to come together and call 911 and go to your physician's office or come to the hospital for an elective case.
The interesting thing about what you just said about community activity, the one community, we are not just a city or a region within South Florida. All of South Florida. In fact, I only hope we are such a disparate state. People don't realize how large our state is.
Yeah, absolutely. Well said, Dr. Lippman. And, from Tallahassee to Miami, there has been support on every level, from the governor's support to Secretary Mayhew's support to the local mayor's support. It's been pretty phenomenal in watching this, not only from my position, but even as an outsider, when you look at the nursing homes, how they were managed so well. And that was a struggle, but we got to know all the nursing residents' leadership, their administrators, and we worked together with them on managing those patients. And it was a really a case study in a successful operation during a pandemic with everyone involved.
Chief Levy, I'm going to give you a moment here because we're down to the last 4 minutes of this show. But I've got to salute you, sir, and I want you to give a big virtual hug to your firefighters and thank them on behalf of the people that you serve, because you, as Jeff Welch has just said, you're part of the heroic and heroine team that is keeping us safe and alive. So, Jeff Levy, thank you very much. We appreciate you being here.
And I appreciate that, and I will most certainly relay that to all of my personnel and the fire rescue community across Broward County. It's one community.
And Dr. Vittimberga, you got to keep everybody on their toes. I know you don't need very much to do it because you got great people working. I salute the physicians, the nurse professionals, and all the other individuals that are in the hospital systems, the respiratory therapists, the PTs and the OTs and the PAs that are alongside of the doctors. It's really a wonderment. I would assume, Dr. Vittimberga, that you're seeing this correlation of what Jeff says, one community, right before your eyes.
Yeah, absolutely. You know, I think it's really true what you said about all the medical staff working with our staff here. And really, we've seen so many examples of people going above and beyond in terms of, their performance and really taking on COVID and not being scared of being involved and engaged. And as Jeff said, we've really had good coordination and outreach with our partners in the community. And really that in the long run has helped us, really deal with this issue. And as I said, we're much better, but we still need to keep our guard up and keep doing the things that we need to do, as you mentioned.
Well, thank you. Again, thank you for all your hard work. We're down to the last, I guess about 60 or 70 minutes, 60 or 70 seconds of our show. And I want to just one more time, on behalf of this population that views us all the way from the Keys up to Fort Pierce, make you aware of the fact that we are very thankful, and actually we're blessed to have the commitment of medical professionals and the people who are, shall we say, advising, like yourself, and offering assistance through their executive management skills of providing us with the very best and safe health care that is possible. Yes, we will have improvements. Yes, we eventually will have some kind of medicaments. Yes, we will sometime have, whether it's going to be vaccination or whatever it's going to happen. The bottom line is we could not get there without the three of you coming together as one unit. So, Jeff, since you're the boss man on this group, I'm going to say right to your face one more time, thank you for your executive leadership. Dr. Vittimberga, thank you for your help with your doctors. And Jeff Levy, thank all those people who helped save our lives, not only during COVID, but all year long, 24 hours a day. We appreciate you, we thank you, and we say as a group, as a community at large, thank you for coming together. The borders of cities and the borders of counties don't count when it comes to this insidious viral infection. So thank all three of you for showing up today on Dateline Health. So folks, I hope that we gave you some insight into the fact that there are people out there that are not doing it for themselves, they're doing it for you. This show, as I said, comes to you from Nova Southeastern University. There's an email address or a telephone number if you want to give us a question. And as I said to you before, my name is Fred Lippman. I come to you from Nova Southeastern University. Until next time, see ya.